All right then, Rodney, you're going to come and introduce me to the team?
In this dramatic episode of Bondi Vet,
oh no.
Arvid is forced to perform surgery by iPhone light during a freak storm.
Power's gone out, the monitor's gone out. We're still in serious trouble.
Can you hear anything?
Scott struggles to keep a rescue bird alive under anaesthetic.
Every moment feels like hours. It is important I see Lola in action.
And Chris gets more than he bargains for when he pays a home visit to little Lola.
Wow.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
In Atlanta, Arvid is paying a house call to check up on his longtime patient Roxy and her very worried owners Alison and Clint.
Well, hello. How you doing?
Good, how are you?
Good to see you.
Good to see you too.
Good to see you, man. Good to see you. How's it? There she is. Look, she's hiding. She's like, no, that's not supposed to happen. Hey, how you doing? Yeah, how you doing?
12-year-old Roxy has been suffering with a mysterious illness that's left her weak and struggling to walk.
We got Roxy when she was about 6 months old. We had been married about a year when we adopted her. And so she's our first child. It was like love at first sight for me. There was just something about her that I had to have her. And she's literally been the perfect dog for our family.
She means the world to us.
Over the last years or so, she's really just started to get weaker, started having a lot of shaky legs, and just kind of started getting increasing lethargic. She just kind of lay on the couch or on the floor and not do much. Roxy used to love to go on walks. She used to like to go to the dog park and play with other doggies, but she just doesn't seem to have the strength to do any of that anymore. She likes to sing for us, which we can still get her to sing. You wanna sing, baby? Yay!
Good girl.
See, that's the Roxy we got to get back.
After a long investigation, Arvid's just discovered the cause of Roxy's dramatic decline, a rare condition called hyperparathyroidism.
That's usually caused by a tumor. Usually, those are benign, okay? But that tumor is causing parathyroid hormone, excessive parathyroid hormone release in the body, which is telling the body it needs more calcium, so more calcium is being pulled from the bones. When that happens over a period of time or long enough, it can cause problems. Weakness in the muscles, bone pain, kidney failure.
To reverse the process, Roxy will need surgery to remove the overactive gland.
We're glad to have a diagnosis, but scared, knowing that the end treatment is surgery and that we will have to put her under anesthesia.
We're scared to death.
I see the nerves.
Yeah.
I see the nerves.
So do you expect Roxy will improve in her condition and be able to have quality of life?
Yes. I will say, with the surgery, we won't see change overnight, because we got to give the body a chance to adjust. But Roxy's always been a fighter, though.
Sounds good. Let's get her better.
We're gonna get her better. Is that okay with you, Roxy? There she is. Roxy has been my patient for 10 years. That's a long time. So she's almost like my pet. They become like family. Yeah, we're gonna have an easy day today. And their owners, we all become like family.
Thank you.
I'll be in touch with you real soon.
Yep.
So It's my duty to help Roxy feel much better and to get her on the road to recovery. I got to do it.
Hi, we're here to check Roxy Richardson for surgery. I think we're all pretty nervous. She's not a young doggy and we're a little scared to put her under anesthesia, but we know we don't really have much of a choice.
Well, good morning. How are you guys doing?
Nervous.
We're here.
Nervous? Understandable. Try to go get you some breakfast and some coffee and just relax, and I'm gonna take good care of her. All right? All right. So today is here, and we're here to take care of Roxy. I diagnosed her with hyperparathyroidism. We did the ultrasound, and the ultrasound showed that she has a growth in the right parathyroid gland. We're here to take it out.
I love you, baby. Okay.
And hopefully, a lot of those clinical symptoms that she was having starts to wane and she can at least regain some of that youth back. That's the point of doing this surgery. That's the goal.
Let's go this way. You're okay. Come on, girl.
Here we go, girl. Go and take a nice deep sleep, and we'll see you when you wake up.
As surgery gets underway, outside a dramatic storm front is bearing down on Atlanta.
It looks like it's nighttime and it's only like 1. My goodness.
Oh no.
It's storming.
Oh my gosh. That's bad. That's so bad. Oh my god.
Dr. Edward, it's bad out there.
Unbelievable. Right when we're about to start her surgery, the power goes out. You can't make this up. Do we have a light? Like a...
Yeah.
Of course.
Right now the power is still out and we are trying to get the power on so that I can get this surgery done. The generator doesn't do the lights, huh?
I'll hold my phone up.
Thank goodness for lights on cell phones. You know, my staff, they jumped right in with their cell phones and pitched in. Right now, the lights on those cell phones are not only saving this surgery, but potentially saving Roxy's life. So right now I'm looking for the nodule in the parathyroid gland that's causing the problem. These surgeries are not easy surgeries to do anyway, but when you add darkness into the equation, that makes it 100 times more difficult. You want to be able to see. This is unreal. Kira, we're gonna have to monitor her heart and everything.
I'm watching her breathe now from here.
Make sure her heart rate's not dropping.
As well as losing light, Arvid is operating without critical monitoring equipment.
So everything is shutting down. The power's gone out, the monitor's gone out. I mean, I guess what I could do is just close her up and do it another day. But I've already come so far, so I'm trying to weather through this literal storm.
And it's not just Arvid who's been left in the dark. Since the power cut off, Roxy's stressed owners have had no updates from the practice.
I know Roxy's mom is on pins and needles. She's probably calling me a few bad words because by now she should have heard something from me and she hasn't. But I don't think I'm gonna call her and tell her that, hey, I'm doing Roxy's surgery in the dark. I got the thyroid and the parathyroid gland out, so I'm done with that. Now it's time to close her up and wake her up. That's what we call improvisation. The power never came back on, but I was able to finish the surgery. Thank God for that. Now, it's just hoping that we get this calcium and everything under control so that Roxy can go into a full recovery. Come on, Roxy, let's go. Let's go. All right.
2 hours later, the lights finally come back on. And enormously relieved Alison and Clint are back to pick up their girl.
I feel relieved that we're gonna get to see her. I'm glad that the surgery's over and it went well. I feel exhausted from being stressed all day.
It was an interesting day.
Here we go. This way. There we go.
Come here.
She wants to go to the
talking to you.
She knows where the door is. Everything was going smooth. Everything was going according to plan. Got Roxy on the table to do her surgery. The storm hit. The power went out.
I saw on the Facebook page that the power was out. I was like, no.
It was crazy. But it all worked out. It all worked out, and I think she's ready to go. I surprised myself on this one. Like I say, we don't ever know what we can do until we're put in the midst of adversity and we're forced to overcome. And I'm just hoping everything goes well from this point moving forward. All right, Roxy, you're on the road to recovery, sweetie.
So now I'm down here in Cornwall. It seems like word's got out a bit that there is a vet for hire. So I've just had a phone call from a wildlife enthusiast who's got a couple of patients that he wants me to take a look at.
Morning, sweet cheeks. Breakfast. Hello. Who's a good girl?
Gary Zammit is the head ranger at Feed and Farm, which is dedicated to the care and protection of indigenous UK wildlife.
Good morning, Rodney.
He's invited Scott today to help with 2 of his rescue rooks.
What are you doing?
The great thing about rooks is they're intelligent, they're extremely affectionate, and they're one of our really beautiful native birds in Britain.
Hi there, Gary.
Hello.
How
nice
are you?
to meet you.
Good to meet you. I'm Scott.
Cheers.
And who's this awesome creature?
This is Rodney. So this is
Rodney.
One of our rooks that won't need any of your attention today.
Yes, well, he's looking
fine.
very healthy. I mean, it's very clear. Rooks are part of the crow family, aren't they? With magpies and ravens and things.
Yeah, that's right, yeah. And so they're very, very smart, aren't you?
And normally, you think of them as a wild animal. So why is this guy on your wrist?
Well, they're all rescues that can't be released. So this one was actually found when a tree blew down in a storm, and he was the only chick found alive. And so he was reared from a tiny baby. So he's totally what we call imprinted, so he thinks he's human.
Hence the human name.
Yes, hence the human name, Rodney.
Yeah.
You're handsome, aren't you?
Will you come and say hi to the vet? Will you? Oh, you're taking a little nibble out of the vet. Well,
Put your
luckily
hand
I'm not
behind
here
him.
to see you.
Put your hand behind him, he'll probably step up.
Hello, mate. Wow, he is gorgeous, isn't he? All right then, Rodney, you're going to come and introduce me to the team? Yeah? Shall we go? Come on then. Come on then, buddy. Come on this way. Here we go. Come on. Hey.
Hello, guys.
Hello, sweet cheeks. Come on then, what have they got for you?
The first patient is a rook called Sweet Cheeks, who was rescued after living most of its life in a cramped cage.
So if I can just go. Good girl, gotcha. Good girl. I can have a little tea towel. Just cover her eyes.
Yeah.
That'll calm her down a little bit.
Sweet Cheeks is probably one of the worst cases I've ever seen. When we got to the house to collect her, the whole place was absolutely filthy. There was a cage jammed in a dark, dingy room with cats climbing over it. And when we got her out of the cage to have a look at her, we saw the deformed beak, the deformed legs and feet, and she was just a mess, basically.
But I can see that malocclusion there and that they're not actually lined up correctly, which is why we're seeing this knot wearing down. Okay, just need to trim that end off, don't we?
Yep.
Poor girl. And just whilst we're there, can I just have a look at these feet? Oh, bless her, look at those. Really are mangled, aren't they? Poor little sweet cheeks, eh? Deformed beak, and then this incredible disability of these 2 club feet, but it doesn't seem to be affecting her. She's eating and happy just like the other ones?
Yeah, she took a long time to settle in, mainly because she was terrified to leave the cage that she'd lived in for 8 years.
So as this one's the one curling over the top, clearly it's not touching at all on the floor, which is why they're growing so long. But I quite like to have a cue as to how long a natural rook's nail is. So I might just see if Rodney wants to come and help me with that. Okay. Come here, mate. Do you want to come and model your feet? Never thought you'd be a foot model, did you? Good boy. That's a good lad. Right, let's have a look at your nails. Okay. So just looking at little Rodney's nails, they're about a centimetre and a half or so. So that's a good guide for sweet cheeks, isn't it? Yeah, it is. Yeah. Do you want to do it? No? Okay, I'll do it. All right. Okay, good boy. So to about there. Try that. Okay, good. So poor little sweet cheeks is suffering with these very long nails because she's got these very deformed feet. She's had an awful life up to now until she's come to be in Gary's loving arms. And the toes are very deformed, and so the nails aren't wearing naturally on the ground or on perches, and as a result they overgrow, which is why we need to trim them. Good, that's good, I'm happy with that. Rodney, what do you think? Hey? I think you probably could have done better. Yeah, all right, so now for that beak. About there, what do you think? All right, sweet cheeks. That's it.
There you are. I know, it's okay.
This side is really off to the left here, so all that is just deviating off to the right, clearly just not rubbing the way it should. Rodney, I'm trying to work.
He wants attention.
I'm nearly there. This is twinging my perfection gene, so I just want to make her beak look absolutely perfect. It does look so much better already. Look at that. Ta-da!
That's better, isn't it? Oh, I know.
What do you think, sweet cheeks? I think that's rook for unimpressed.
Yeah, I don't think she's impressed at all, are you? Good girl.
Good girl. Well done. All right.
That looks a lot better.
Oh, clip nails, sorted out beak so she can go.
Good
girl. Well done.
Come on in. Easy, easy, easy. There you go. Oh, that looks better, doesn't it?
Oh, thanks, Rodney, for the present there, eh? Didn't they say something about it's good luck to be pooed on by a bird? I think that's what people that haven't been pooed on say. Yeah.
Ow, that's not very nice, Nelson, is it?
Gary's next patient for Scott is Nelson, who has a far more serious problem with his wing.
There we go. Nelson was brought here by a lady who found him just running along a road with one wing drooping. And when she got closer, realised that Nelson couldn't actually take off. Nelson's wing just seems to have drooped more and more with time. And unfortunately, it's getting to the stage now where it's tripping over the wing gets tangled. And then you have the dilemma, do you just euthanize it or do you see what you can do?
Just have a good feel. So you've just been trimming the feathers just because she's been tripping over them?
Yeah, it just takes the weight off it a bit.
It just feels quite wasted, so sort of a section of muscles called patagium, and it's maybe it's been affected at some point, so rather than there being an obvious break, it's just weakness, and so the wing is just dropped down. Yep. But unfortunately, that muscular structure also contains nerves, and if the nerves are irreparably damaged, then unfortunately never will this rook be able to use the wing properly. What I do think is that he suffered a neurological injury. There's something called a patagium, which is basically a sort of a thickening of nerves and tendinous structures that runs down from the shoulder all the way to the wrist joint, the metacarpal. And I wonder if he suffered an injury there, it's damaged the nerves irreparably, and now he can't move his wing properly. Therefore, I would actually suggest amputation, removing the wing completely.
He's never going to be releasable, but I just feel with the wing gone, his quality of life's going to be better.
All right, let's put this boy in a box.
Okay. There she goes.
Okay, Gary.
All right.
Let's go.
The reality is it might sound harsh taking a wing off, but the wing's doing nothing at all apart from making Nelson's life more difficult. And Nelson could have another 30 years or so. So we want to make those 30 years as comfortable as possible.
Scott will perform the delicate surgery with a new team at a local vet clinic.
Come on then, Nelson.
Thank you.
Sit.
Okay.
Let's go. Come on in. Hello, everyone.
Afternoon.
Hey, gang. Hi, I'm Scott.
Hi, Steve.
Hi, Steve. Nice to meet you.
Yeah.
This is Gary.
Hi, Gary.
And this
Nice
is
to
my
meet you.
rook patient, Nelson, who needs a wing amputation.
Okay. I think Claire's in the prep room ready for you, so if you want to go through, it's perfect.
Great. All
Thank
right.
you very much.
Thanks very much. Come on, let's go.
I've drawn up the drugs ready to go there. All right, so ready to
Waiting to assist Scott are vet nurses Tash and Claire.
X-ray and then prep afterwards.
Well, hello.
Hi.
Hi, I'm Scott. How you going?
Hi, nice to meet you.
Claire, hello.
Hi, Tash.
Hi, Tash. How are you? So this is Gary.
Nice to meet you.
And Gary has our rook patient, okay? So Nelson needs a wing amputation. So if you pop him up there and say your goodbyes.
Okay. See you later, Nelson. Yeah, he's nice and calm.
Okay.
There you go.
All right.
Okay.
Take it easy. We'll see you on the other side.
Okay,
All right.
thanks.
Cheers, Gary.
Cheers.
Where are you, mate? There you are. There you are. I've got you. I've got you. It's okay. 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 Okay, I've got him. Shh. Yeah, got him. There he is. Isn't he incredible?
Yeah.
That, as we know, anaesthetics in birds can be quite risky. This guy seems pretty chilled, however.
It's really calm, isn't it?
He's really calm, and hopefully we'll all be cool, calm, and collected. One of the big things with bird anaesthetics is that we need to just do everything as quickly as possible because they're very delicate creatures. We want the anaesthetic to be short and we want them to wake up quickly. So everything needs to move at pace. So this smells gross, all right? But then you'll wake up feeling much better. Which that seems pretty good fit, actually. So I'd let you know when he's going a little limp. I'll know that because he's really got good hold of my finger.
Are you that in?
Yep, he's going a little limp there.
With Nelson now under anaesthetic,
Okay, all right, happy, Tash? All right, let's go.
Scott can get an X-ray of the bird's damaged wing.
That is just the weirdest thing I've ever seen. Where's this bit of bone gone, Nelson? Hey? I'm really perplexed by what I'm seeing because he doesn't have a part of his humerus. It is literally not on this X-ray. It's so unbelievably weird. I really don't know why or how that's happened. All I know is it's going to make the amputation easier because he doesn't even have bone to cut through. So, happy days, but super weird. So, ladies, a little bit of a turn up for the books in that the humerus already has a gap in it. So, I thought it was very strange when I was feeling it then, but that's clearly why he's not been able to use his wing because it's simply not attached to the rest of his body.
At least there's a good reason for it.
Yeah.
Right, brilliant.
Yeah, and it means less work for us.
Yeah, perfect.
Yeah. All right,
Okay.
I'm going to get changed into my vet gear.
Okay.
You guys keep bucking. All right.
Okay, he's stable. He's got really good sound, strong heartbeat. Regular,
Brilliant.
that's good.
Good.
You happy?
Struggling to hear.
Just pop the raid there.
Just turn the ISO off if you think so.
Seconds later, Nelson's heartbeat has dropped alarmingly.
You just go quite right round the side. Just can't hear it. I don't know whether it's just my hearing, if it's that light.
As we're desperately waiting to hear from Tash so she can hear Nelson's heartbeat, just time starts to stand still and every moment feels like hours.
I don't know if I can just hear machines. Yeah. Turn the ISO off.
Just turn the ISO off. Anything?
Can you hear anything?
Now that Nelson's struggling under the anaesthetic and we can't hear his heartbeat, we turn the anaesthetic off. So hopefully he'll start to lighten up, but it does take quite some time before we can hear any heartbeat at all. Happy? Right. Okay. Unfortunately, my friend, I'd have much more finesse than normally, but this is not gonna be my prettiest. I think Nelson was in a whisper of death, honestly. Like he was just so close to not coming back. And anaesthetics in birds are risky. So we'll just skin there. Okay, so this will be the sore bit. Oh.
Okay, right, I'm going to put him
again.
back to 3.
As I start to move forward with the surgery, Nelson's anaesthetic again takes a turn and he starts to wake up. Is that the mask?
Yeah. There you go. Right, go back in there, mister.
We react by increasing the anaesthetic and then he goes down again, but it's a hell of a roller coaster ride. Okay, girls. Okay, you ready?
Yep. Yep.
Here we go.
Okay.
Off.
Yeah.
Right. Okay, Claire, you still happy?
Yep.
So that's the last stitch, so let's wake him up. Oh, I don't know about you two, but I nearly had a heart attack doing that.
Yeah, pretty
stressful.
scary anaesthetics,
Oh.
yeah.
Wow, we did warn Gary. I don't know if we warned ourselves.
No.
I think supposed to be the harbingers of death. We want him to see the light. Come back towards the light. Come on.
The shock sometimes that can kill them after the operation,
right.
which is
Yeah.
the recovery is sometimes the more risky part, isn't it? Which is,
Yeah. Nelson.
yeah, he's coming. He's coming.
Okay, mate. Come on then. That was hellishly stressful. And honestly, I feel like we've literally saved this guy's life a couple of times during this procedure. And now, hopefully, if he comes through this anaesthetic, he's going to make a full recovery.
Yeah.
So I think we can all feel very proud. Here we go.
His eyes are open.
Yeah, his eyes are open. Look at that. He's a fighter.
Say hi.
Feel better now.
Hey, you must say thank you to the girls. Hey, thank you for saving my life. Hey, hey, you've given all of us grey hairs. Yes, you have. A truly incredible experience has happened here in Cornwall with this rook because it was a very short anaesthetic on a bird that needed a surgery. It was absolutely right to do it, but to go through it with strangers and come out of it with 2 new friends and a rook that survived without the wing that it didn't need, it's an absolute miracle. So here he is.
Looking a bit smaller.
Yes. So the girls and I have just completed an amputation, so you can just see the site under there. The girls did an amazing job at plucking. So, and Gary, I've got some very odd news for you in that actually he was missing a piece of his upper forearm. So his wing wasn't actually attached to his body. It was only attached by skin and sinew and muscle. But the bone literally disappeared. I don't know where it is, but it's not in your bird.
All right.
But after some, shall we say, anaesthetic challenges, girls, we'll just leave it at that.
Yeah.
Anaesthetic challenges,
Right.
we've managed to get your boy through and we're just
Brilliant.
chuffed for you. We're
that's
very,
brilliant.
very proud of ourselves and of him. And now we want you to take him home and give him lots of love.
Brilliant. That's
All right.
lovely. Thank you.
Gary, let's pop you in. Good boy. All right, in you go, lad. In you go, lad. That's it. Good lad, good boy. Girls and I are going to the pub. Seriously, pub.
We've been promised a beer.
Yeah, at least one. You've earned it.
Brilliant.
Right.
Thank you.
Cheers, Gary.
Lovely.
Good on you, mate.
Thanks a lot.
All the best.
Cheers. Thank you.
We'll come and visit him. He's only up
Yes.
the road, so.
Yeah, please do.
Bless him.
Cheers. Thank
Bye.
you.
Okay.
All right then. All right. Come on.
Bye, Nelson.
Bye, Nelson.
Bye.
Oh, right. I'm never doing a rook anaesthetic ever again.
Nor am I.
Although, can I say, girls, high five.
Good morning, Nelson. How are you doing? There you go. Good.
Next morning, over at Feed and Farm, Nelson the rook is recovering well from his amputation surgery.
You're looking good, aren't you? Have some breakfast.
Hey there, Gary.
Oh, morning.
How are you?
Yeah, good.
Right.
Yeah.
How's my rook patient doing?
Brilliant. No, really, really good.
Mate. Oh, he looks fantastic, doesn't he?
Yeah, so much more comfortable looking now.
Yeah. Today, Nelson is looking absolutely fantastic. You would never know that he's been through quite the bumpy ride that he has, and he seems fighting fit. That's it. And then there's that little suture line in there. Looking good. Very small, really.
Yeah, I'm surprised how small that wound is.
Right, mate, you can go and see your mates, hey? Go and find that girlfriend of yours, hey? Come on then, let's go.
Good boy.
Hello, team. Hello, Rodney. Hello, champ. Look, we got your buddy back. Look. Look. Hi. How are you this morning? Hello. Look. Look, it's Nelson. There he is. There's your buddy. There he is.
Yeah.
All right, Nelson. You go find your girlfriend now, buddy. Okay. And there he is. Fantastic.
That's great, isn't it?
Yeah.
So, that's his mate there calling now.
Gary, thanks so much for the opportunity to perform this procedure on your rooks and for sharing your passion, because now, being with these guys just for a couple of days, I can really see where that passion comes from. They're awesome.
That's great. No, thank you. I mean, Nelson there's looking great. He's going to be a lot more comfortable.
Yeah.
And Sweet Cheeks Beak's looking great. And yeah, it is amazing how once you spend a little bit of time with the species that you might not think much of before, it changes your attitude. And that's the whole point of what we do.
You all right, Rodney? Do you want to come home with me? You're pretty cool.
And he is a bit of a star, isn't he?
Oh, he's a ledge.
Somehow I think we got the right house.
Chris is in Melbourne to try to sort out a problem with a very vocal cavoodle.
You Lola? Hey? I'm told that Lola has some bad antisocial behaviour that needs addressing. I'm not so sure if this is it or if there's still more to come.
Hi, Chris. Come on in. She won't bite. There we go.
Hilarious.
I know. She's just got this little tiny...
Intimidating.
Owner Serena is desperate to find a cure for the 5-year-old's outrageous antics.
When people sit on our couch, she jumps up next to them and starts humping their arm.
I noticed that I've managed to get in through the gate, thankfully with my life intact. There was no humping of legs.
She doesn't do the legs at all. It's just the arm when people are seated.
How long has she done this for?
She's 5 now, and probably since she was about 4 months old.
Okay. So it's always been a pretty big part of her.
It is.
Having my arm humped isn't anything I ever thought would be happening today. But if I am going to help out Lola and Serena, it is important I see Lola in action. I can't believe I'm willingly putting myself in the hot seat, quite literally, but she's going to be offended if she doesn't do it.
So will I.
Oh, she's getting nervous. I'm getting nervous too. It's a good sign, right? This is just a foreplay.
I think so. I think so.
I'm sitting down. Lola's doing a lot of talking, but as for getting amorous, nothing so far. She'd like it if I talk or just stay quiet?
Just, maybe just play with her a bit.
Hey.
She's growling, she's circling a bit. Lola wants his attention and she's just so loud.
All the pursuit of science, Lola, come on. I'm just gonna sit back and just,
There we
go. Wow. Career high point. I really don't get paid enough for this. This is certainly not the typical house visit. When I first arrived and met Lola, she was all talk and no action. Now she's no talk and all action. And what action? In many respects, it's fascinating to start with when you have a desexed female dog.
Yeah.
Not just desexed, but female. Humping.
Yeah.
Because humping isn't something we normally associate with females at all. A lot of people think that when they see a dog that's humping, then it automatically must be a sexual thing. Well, often it's not. So the crucial thing here is working out Lola's motivation. I just want to try something.
Okay.
I'm making a lot of eye contact at the moment and she's not doing it. But we'll just see what happens when I go over here and look over here and start talking to no one in particular. And
Here we go.
look what happens. I'm starting to wonder whether Lola's antics are actually her way of getting attention. So there's really two things we have to look at. The humping, sure, because Lola, I hate to say, it's a little antisocial, a little forward, and the barking.
Yes.
Because that's not exactly pleasant when you're sitting at home trying to relax. Thank you.
We can clown around and say this is funny, it's cute and it's engaging, but in fact I think it's about a dog that's in distress, and as her owner, I don't want that for my pet.
Dogs are very different inside versus outside. You need to get the whole Lola picture.
All right.
Could we go for a bit of a walk?
Yeah, sure.
All right.
Yeah, let's do that.
The fact is, this behaviour does need to be controlled. So the whole idea now is to take her out of her territory and see what happens. Hopefully, that'll give me a clue about how I can fix it. There's not a sound, is there?
No, she just really enjoys her walk. She just wanders along.
Butter wouldn't melt.
I know, she's like the perfect dog in public.
And this isn't what I expect from a dog that just put on such a show.
Yep.
And was so loud.
It's so incongruent, isn't it? It's really, the many shades of Lola.
The amazing thing is you take Lola out of the house where she feels like she has total control over everyone, and all of a sudden, we've got a different dog. There's no barking, and there's certainly no humping. With all sorts of behavioural problems that you see as a vet, I'd say the majority of them involve either dominance, territorial behaviour, attention seeking, pretty much those three. She's actually got all three of those.
She's the trifecta.
She is. Yeah. This double life that Lola's leading, where she's well behaved outdoors but poorly behaved indoors, it's not fooling me. Even though this has only been a short walk, it's given me enough time to come up with a solution that I'm pretty sure is going to end Lola's humping ways forever. I'm going to meet you back at your place with my solution.
Alrighty, thanks, Chris.
I'll see you soon.
Come on, pups.
Hello. Yes, the game's up. How Serena has put up with Lola's behaviour for all this time, I have absolutely no idea, but I'm quite sure she's really going to appreciate the solution that I've got in mind. Let me guess. Yep. Right back to where it all began. So, I've come up with something that is going to change the rules around here.
Okay.
It's high tech. Highly expensive.
Right.
It's going to blow your mind. You ready?
I'm totally ready. A leash.
A dog leash.
Right. We have one of those. Yes.
This one is now her inside leash.
Right.
The idea behind an inside leash is actually pretty simple. It gives Serena back her control and means she can correct Lola without touching her, without talking to her, without giving her any attention whatsoever. So, the moment the bad behaviour starts again, get the end of the leash, haven't looked at her, haven't talked to her, and now get hold of her, and we walk her, whether she likes it or not, in here, and shut the door.
Right. So Chris puts her in the laundry. She's in there for 3 or 4 minutes. Not a peep out of Lola, which is so unusual. Okay.
So we'll go back up here.
Okay.
I can't believe it. We have silence. Immediately, there's not a lot of interest.
I think Chris has nailed it, and it's down to me to help her with this.
So it's the start.
It is. It's a great start.
And let's hope that is all it needs.
Alrighty. Okay. Thanks, Chris.
Thanks, Serena.
Thank you.
My pleasure. I was expecting a result, but this is pretty much instantaneous. All of a sudden, Serena is now back in control, all thanks to a leash. A lot of people think leashes are just for outdoors, but indoors, they can be pretty effective too.
Hey, you want to say goodbye? No, I think she's over you. It was beautiful while it lasted.
It was special. I'll never forget you, Lola. Thank you.
See you, Chris.
See you later.
Bye-bye.